Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the 9 p.m. live English news edition. Here are the top stories. Head of State shares the 60th Council meeting of Ministers. In USA, nearly 1,200 dead in the United States in these 24 hours. Hello and welcome to our newsroom. Under the chairmanship of His Excellency Mr. Ismail Umar Gele, President of the Republic, Head of Government, shared the 60th session of the Council of Ministers held this Monday, April 6, 2020, under the chairmanship of the President of the Republic. The following texts were approved and examined. The Minister of Health, first question, communication on evolution of the COVID-19 pandemic in Djibouti. The Minister of Health made a communication to the Council on the situation of COVID-19 epidemic in our country. He indicated that as of 6 April, the total number of persons positive for COVID-19 on the national territory was 89 and 9 cases had been cured. Since the beginning of the epidemic, 2,229 tests have been carried out in the laboratory located in Bufar. His department has begun an aggressive response against this virus with the active search for contact and suspect cases through the investigation carried out by the investigation unit and calls received on the 1517, the Green Line. In this context, in the meeting, the challenge, the Ministry of the Health has set up a response mechanism which includes a response plan drawn up and disseminated to all health personnel involved in the fight against COVID-19. A crisis committee responsible for holding a regular meeting to take stock of COVID-19 situation and inform the population, a communication and information plan. In addition, it is planned to extend 2 sites dedicated to quarantine and care. This mechanism has been reinforced by the implementation of measures taken by the government and the mobilization of resources. In terms of training, the training of medical personnel involved in the response to COVID-19 will be reinforced and extended to all healthcare personnel. Finally, in view of the evolution of the epidemic in our country, the minister affirmed that it is imperative to adopt good practices and to implement the prevention measures recommended by this department. Minister of Economy and Finance in charge of industry, second question, communication on the socio-economic consequences of the COVID-19 pandemic. The Minister of Economy and Finance made a communication on the socio-economic consequences of the COVID-19 pandemic and indicated that this epidemic that has spread throughout the world has impacted the global economy. As far as our country is concerned, the consequences are almost immediate as budgetary space is limited. Our revenues and expenditures are in a state of strained flow and our reserves remain limited. Thus, he said that all sectors of the national economy have been impacted by the effect of this pandemic, especially budget and economy revenues and employment. In this current context, and in order to mitigate the adverse consequences on economic, social and health activities, a COVID-19 Emergency and Solidarity Fund was created and endowed with 1 billion franc Djibouti. On the other hand, it provides information on emergency measures to support the economy and employment and mobilize exceptional resources. Question 3, draft law on ratification of the loan agreement on the financing of COVID-19 response project. The purpose of the bill is to ratify a loan agreement for an amount of 5 million USD, about 900 million Djibouti franc between the Republic of Djibouti, and the IDA within the framework of the COVID-19 response project. This funding will make it possible to give priority to meeting immediate needs and providing an appropriate response to the health emergency, as well as to strengthen the capacity to prevent, detect and manage the threat posed by the coronavirus. The project has 4 major components. The first aims to reduce and limit the spread of COVID-19 in the country. It will also support the acquisition of equipment and consumable essential for laboratory and diagnostic systems. The second component aims to strengthen the delivery of basic health services in order to provide the best possible care to those infected. It will also support health training and the establishment and equipment of quarantine and treatment centers. The third aims to finance the project management costs necessary for the implementation of and monitoring, evaluation of activities. And the fourth is to provide an immediate and effective response to specific needs that may arise in the event of a crisis or emergency that may arise. Finally, this financing project will ensure an effective response to COVID-19. The rest of these ministry councils, the Ministry of National Education, let's listen again.
Deuxième question est relative à une communication.
Ministry of National Education and Vocational Training. Fourth question, communication on the assessment of the tele-teaching, the e-teaching, and e-learning devices implemented by MENFOP. The Ministry of National Education and Vocational Training has made a communication to the Council of Ministers on the assessment of the distance education system implemented by MENFOP. Thus, televised courses for all levels and all disciplines have been set up. For basic education, radio courses have been broadcast at the rate of 1 to 2 sessions per discipline per level and per week. He stressed that since Sunday, April 5, 2020, the e-learning platform is for all students and the courses and activities of a week are deposited by discipline and level. A total of 1,000 sessions and programs have been designed and broadcast, and 200 people have been mobilized. These distance learning devices have made it possible to meet the essential needs of learners. Minister of Higher Education and Research. Fifth question, communication on pedagogical measures taken at the University of Djibouti. The Minister of Higher Education and Research made a communication on the education measures taken by his department. He recalled that 5 weeks of courses had yet to be finalized and 3 weeks for some courses. In this current context of confinement, it was decided to put online the courses of the university's teachers in order to ensure pedagogical continuity. Concerning the engineering faculty, a certain number of measures have been taken in accordance with international standards, in particular the provision of digitized content to students, to ensure real pedagogical continuity. In addition, the ministry informed that accompanying measures had been taken, including the training of nursing staff by providing a mannequin for learning intubation and breathing apparatus techniques. Today, as usual, the Secretary General of the Ministry of Health gave his daily press briefing on the situation of COVID-19 epidemic in Djibouti. This Monday, 6 April 2020, the situation of the COVID-19 epidemic in Djibouti is as follows. 530 tests carried out, 31 positive cases of COVID-19, of which 25 are from the Al Rahma hospital, 51 people under surveillance at the quarantine center, 49 patients under treatment at the RTD hospital. According to today's results, the Al Rahma Hospital Center constitutes a new outbreak of the COVID-19 epidemic in Djibouti. This hospital is currently under quarantine. Investigation and disinfection activities have been ongoing since yesterday. To date, there are 90 confirmed positive cases, including the Spanish soldier who left the national territory at COVID-19. The data of 2,229 tests have been performed. 9 cases cured, 0 cases of death. The increased capacity of the laboratory installed at the Bufar Hospital made it possible to carry out large-scale tests. This dynamic of massive screening will be maintained to contain this epidemic. The current major challenge for the Ministry of Health and patronage sectors is to find all the people who have been in contact with the positive cases. To this end, the reinforced investigation teams have undergone rigorous training. We therefore all call on anyone who has been in close contact with the staff of the Al Rahma Hospital Center to report to the Bufar Hospital for screening for COVID-19. And now we reiterate our call to all Djiboutian passengers who came to Djibouti from 14 to 17 March who have not yet undergone COVID screening test to report from 8 a.m. to 12 p.m. to the Bufar Hospital. We reiterate now, we calling on the foreigners who, we call on them foreigners, passengers who came to Djibouti on 14 and 17 March and who have not yet undergone COVID screening test to report from 8 a.m. to 12 p.m. to the Bufar hospital. Pursuant to the sixth article of the Rules of Procedure, the President of the National Assembly, Mr. Mohamed Ali Hamid, called on the office of the legislative institution to define the procedures and methods enabling the National Assembly to pass laws of an urgent and pressing nature in order to strengthen effort to combat the coronavirus pandemic in our country. The President of the National Assembly, Mr. Mohamed Ali Hamid, his closest collaborators and deputies agreed to implement all activities aimed at protecting and preserving democratic practices. And now the multi-purpose dollar report in DMP, in close collaboration with the General Union of Djiboutian Worked, the UGTD organized today within the DMP an important sensibilization session for the dockers or professionals handlers in this period of crisis of the COVID-19. The session was attended by the General Director of the Port, Jama Ibrahim Darar, the Director of the Port Labor Service, Usman Hassan, the President of the Port Labor Service Union, Barasa Musa Adan, the Hygiene Security Manager of the DMP, also President of the COVID-19 Commission, Joel Nervo, and the Secretary General of the UGTD, Said Yunis. Like other public and private institutions in the country, the DMP has also taken all the necessary steps to protect against this pandemic. A comprehensive system has been set up, such as hand-washing points in each port area, agents for disinfecting vehicles and premises. The reservists then stood up in front of the 130 professional handling agent or dock workers to remind them of the various barrier measures put in place to combat COVID-19. The National Union of Djiboutian Women, UNFD, today proceeded for the third time at the King Farah Complex Stadium located in the commune of Babala to distribute food to 700 poor families in the commune of Balbala, and a total of more than 3,500 households benefits from this outpouring of solidarity. This time, the categories targeted today by this distribution consisted of day laborers such as bus drivers, Bajaj drivers, young Bajaj drivers, and construction workers. It is in this spirit that the National Union of Djiboutian Women, always at the service of the people and the most disadvantaged, under the leadership of the First Lady and President of this non-profit organization, Khadra Mahmoud Haid, has been carrying out food distribution operation from vulnerable households affected by the containment imposed by the government for more than a week. Indeed, the containment measures decreed by the government to limit the spread of COVID-19 and the needs they induce have worsened the social situation. Most of the beneficiaries alive from informal work, bus drivers, Bajaj drivers, young Bajaj drivers, and construction workers. These food parcels are mainly composed of basic necessities including rice, sugar, flour, eggs, black tea, oil, and vegetables such as tomatoes. This food basket is intended to cover the food needs of extremely vulnerable population for 1 month in order to comply with containment measures. The launching ceremony of the food distribution operation was supervised by the UNFD Vice President Mrs. Hasna Ahmed Bilil and the UNFD Secretary General Mrs. Fatouma Musa, as well as UNFD staff. The UNFD officials reminded the population of the need to stay at home to stop the coronavirus epidemic that continues to progress in our country, and the government is working to assist the poorest family. On this occasion, the beneficiaries did not fail to thank the First Lady of the country, Khadra Mahmoud Haid, for the generous assistance to this population. Following the example set by the President of the Republic, Mr. Ismail Margelo, who was the first contributor to this solidarity, the three leaders of the cat importers company, namely Hussein Ahmed Farah, President of the Independent Cat Importer Union SIKI, Ahmed Hassan El-Tiri, President of the Barwaqa Syndicate, and the Vice President of the Cat Importer Union, today made a donation of $21 million for the fight against COVID-19. Let us recall that this legendary surge of solidarity of Djiboutians launched even in the working class neighborhoods. Committees are working to raise funds for the fight against COVID-19. The Vice President of the Commercial Union Importing Cat SUCIK, Suleiman Ali Dahir, said that this gesture is highly commendable. The leaders of the Barwaqa and SIK trade union, Hussein Ahmed Farah and Ahmed Hassan El-Tiri, have pledged to support the government of Djibouti in various actions to help the country's vulnerable population in this period of health crisis. They declared that we will always be available alongside our people to make our meager contribution, which is truly a laudable gesture to our Lord Allah Azza wa Jal. The gesture of solidarity towards the fight against COVID-19 continues. Now, existing societies, high-ranking officials, and civil and political personalities are taking part in this wave of solidarity initiated by the President of the Republic. It was the turn of the electricity of Djibouti to contribute the sum of 100 million Djibouti franc to take part in the solidarity drive against the coronavirus. It should be recalled that the President of the Republic initiated a solidarity fund against COVID-19 to meet the demands of health facilities and social solidarities. It should be also noted that the Director General of Electricity, Mr. Jama Ali Gele, has personally contributed the sum of 5 million Djibouti franc to the solidarity funds against the COVID-19 in Djibouti. And now moving to another subject, following the appeal of the President of the Republic, Mr. Ismail Margelo, the President of the RPP Annex of District 5, Mr. Suleiman Ali Dahir, personally contributed to the sum of 100,000 franc Djibouti to participate in this solidarity initiative. Indeed, it is in this context that the President of the Annex, Mr. Suleiman Ali Dahir, yesterday made a statement calling on the generous donors to contribute what is their will to stand by the head of state, Mr. Ismail Margelo, and declared that solidarity will always be the motto of our country in order to fight together against this disease which has paralyzed the whole world. Moving now on the international news, in USA, in 24 hours, more than 1,200 people died in the United States, according to figures released Sunday. Health officials warn that next week will be a Pearl Harbor moment, like 9/11 across the country. On Sunday, April 6, an additional 1,200 people died from the COVID-19 in 24 hours in the United States, according to the count released by Johns Hopkins University. The country has recorded 337 and 72 cases of affected and 9,633 deaths. According to this database, the Federal Administrator of Public Health Services has prepared the public for the worst. Next week will be a Pearl Harbor moment, like 9/11 expected won't be localized, it will be all over the country, he warned. For his part, President Donald Trump warned that Americans should expect a terrible death toll during the peak, not yet reached, of the epidemic. Trump, however, reiterated his desire to revive the economy. We want to get people back to work. Everybody wants to come back. We want to open up the country as quickly as possible, he said. This is it for this edition of 9 p.m. Thank you for watching us and have a wonderful night.